Hi everybody, my name's Sarah Heath. I'm a veterinary surgeon and I'm a specialist in veterinary behavioural medicine. So that means that I deal with emotional challenges in dogs, and at this time of year it's very much likely to be related to noises, particularly fireworks as we approach Halloween and bonfire night. So in this short video I'm going to be looking at the management of firework related emotional challenges for dogs.
By the way, check out the code in the description for 50% off your first webinar at Webinar Vet.
There are four main components to our management strategy. One is how we modify the environment. The second is what changes we make in human interaction. The third is the possible use of adjunctive therapies like pheromones or nutraceuticals. And then the fourth is the use of short-term medication in order to reduce the emotional impact for those dogs going through what are going to be inevitable events over the next few weeks. So let's first of all look at environmental management. This basically is about providing a safe and secure location for the dog to go during the exposure, what we would term a hideout. And the important features of that hideout are that they are safe and secure, but they're darkened and they're quiet, but most importantly that they're available 24/7. Because if you have a safe location, you've got to be able to get to it whenever you need it. So when we're talking to caregivers, they need to select a location that's going to be okay for the dog to have access to all of the time. Some dogs will naturally go to that hideout because they use more of an avoidance response when they have a fearful reaction. Others might need to learn about that hideout away from the firework season, be taught to go into that location for positive things like food treats or to rest and relax. So the hideout is an important part of environmental management. The second thing we said we were going to talk about was changes in human interaction. Now, humans love to reassure someone if they feel that they're frightened or anxious. And so it's very tempting for caregivers to get actively involved with their dog if they feel that they're frightened. But how the human should respond really depends on which behavioural response the dog is using to deal with its emotional challenge. So dogs that are protective in their emotions, so fearful or anxious or frustrated, are likely to use one of four behavioural strategies. If they use so-called appeasement, what that means is that they're going to actively exchange information with the caregiver. One of the problems with that strategy is that then having the caregiver present during the challenge is absolutely essential. So for these animals, if the caregiver is then not available and there's an unexpected exposure to the sound, that can make the fear anxiety much worse. So if we have a dog that's using appeasement, coming over and trying to gather information through leaning or licking or sniffing and trying to give information back through its body language or maybe through rolling on its back and exposing its scent signals, it's really important that the client remembers that they shouldn't over-encourage that behaviour, that they should try and be passive and calm, but definitely never reject or ignore that behaviour either. So if a dog is worried and is trying to get support from their caregiver, being rejected or being ignored is going to make the anxiety worse. But if we over-respond, if we supply lots of information, then that reliance on the caregiver being present might develop. So with an appeasement response, a calm, passive supply of minimal information is the key. If they're using avoidance behaviour, which is where they're trying to retreat from the sound, it's really important that we enable that response. And that is going to be involved with the provision of the hideout that we just talked about. So somewhere for the dog to go to be safe when it uses an avoidance response. The third way in which a dog can respond to protective emotion is through what we call inhibition. This is where they just passively gather information. So rather than actively interacting with the caregiver, they're just sitting watching and listening. And the response to that is to make sure that the signals they get back are of relaxation. So when they're staring at their caregiver or listening to what they're doing, for the caregiver to be relaxed and therefore give signals back that this is a safe environment. It is possible that some dogs will use a repulsion response when they are fearful and anxious. So they may growl or grumble. And if that is the case, it's very important that we reduce all interaction. So make sure we don't persist in trying to engage, because that's just adding more emotion into the situation. So moving on to providing support through nutraceuticals or pheromones, what do we do in that situation? Well, the aim is to create a more positive emotional bias or a more engaging emotional bias in the dog. We can do that through pheromones because pheromones are a natural form of communication. Adaptil Calm is a product that's an analogue of a naturally occurring pheromone that comes from the mammary area of the bitch when she's suckling her puppies. And it signals that the situation is safe and secure. So by installing a diffuser near to the dog's hideout, we can increase the sensation that that's a safe and secure location. The nutraceutical approach is about adding certain nutritional elements, usually through the form of capsules or tablets, or sometimes through specific diets, where increasing the availability of those nutrients increases the animal's ability to produce certain neurotransmitters. Now, those neurotransmitters we wish to increase are things like serotonin, which is the neurotransmitter associated with relaxation, dopamine, which is associated, of course, with confidence, and then also GABA, which is an inhibitory neurotransmitter to dampen the protective emotional response. So that's certainly a possible adjunct during this upcoming season. We would usually advise that you start with the pheromone product about a week before you expect there to be problems. That's going to be fairly soon to make sure it's in place before Halloween. And then also thinking about the nutraceuticals in that way as well. The final approach we're going to mention is the potential to use medication. And what we'd be thinking about here is using short-term medication to limit the emotional impact of having exposure. So this is going to be medication that will take effect quickly, that can be given just an hour or so before the event. And the majority of the medications that are available for this use do just that. So we have the benzodiazepines, we have things like the microdose of dexmedetomidine, or we have things like trazodone, all of which is an SARI, all of those are able to change the level of certain neurotransmitters, but do it relatively rapidly, and therefore we can give it about an hour before the expected event. Slight differences in the way that these things are administered. So the benzodiazepines and the SARI trazodone are given in tablet or capsule form. The dexmedetomidine dose, a microdose, is given in a gel that you put inside the mouth and onto the inner surface of the cheek of the dog. So again, there may be certain cases which are more amenable to one or other of those approaches. There is another medication, nimepitoin, which can also be used for short-term management of the environment, the emotional impact of these firework events, but that is given on a twice daily basis over a 5-day period or so over the firework season. So a slightly different approach. But as we approach this season, one thing we know is that these problems are common. There's estimated that 49% of dogs in the UK population actually have fears and anxieties related to noises. So when these fireworks start over the next few weeks, there will be many, many dogs and caregivers who are worried about this season. So as veterinary practices, veterinary professionals, we're often asked for advice. So hopefully this video has just helped you to think about those 4 steps. Change the environment, change the human interaction, think about adjuncts, pheromones and nutraceuticals, and use short-term medication to limit the emotional impact of the coming season.
Thank you for watching. If you've enjoyed the video, please like it, leave some comments, subscribe to the channel, and if you do click on the bell, then you'll also get notifications of any other videos that we do. For those of you involved in the veterinary profession, please do go and look at our sites, thewebinarvet.com and Wikivet, where you can learn lots of really interesting things, and we'd love to have you in our community.